So it's a pleasure to be here at the AO at the last lecture of this room. So I'm going to try to do a good job because you all could be out there eating some oysters and having a beer, right? And you chose to be here. So I'd like to thank the scientific committee for inviting me to be here. It's a pleasure. It's an honor to be at the AO. And I would like to disclose a conflict of interest that I have. I'm a key opinion leader for Orthodontics, a company in Brazil that is distributed in the US by Specialty Appliances. I normally speak on the subject, which is hybrid orthodontics. And I'm a co-founder and of an aligner company in Brazil. So I do have some conflict of interest in the subject. However, I don't think there's nothing commercial here, but I do need to disclose this. So the question is, why should we go hybrid? It is because aligners, they might not be as effective or efficient when compared to fixed appliance in very specific situations. If we look at the literature, especially with the reviews, the current evidence does not support the clinical use of aligners as a treatment modality that is equally effective to the gold standard of braces. If we look at this review made by Spiridon, we can see that several of the movements, buccolingual inclinations, rotations, they are not as good with aligners as they are with braces. If we can further look into other scientific systematic reviews, clear aligners, they may produce clinically acceptable outcomes that would be comparable to fixed appliance therapy for buccolingual inclination of upper and lower incisors, only in mild to moderate malocclusions. So when we go towards more severe malocclusions, aligners do not do as well as fixed appliances. So that's the reason why we should look into hybrid orthodontics. So first of all, the two situations where we should use hybrid orthodontics is either when aligners are not good enough to do something, there is when they're not effective. And the second, which I will discuss further, is when they're not efficient. They might be good to do a job, like they might be good to do distalization, but they take too much time. So first of all, we are going to talk about efficacy. So when they're not effective. And there are several situations when they might not be effective, and I'm going to cover only 3 of them. So first, angulation control. And therefore, root movements, they may call for hybrid orthodontics. So when we're talking about angulation control, someone must come up and say, well, let's talk about molar uprighting. But there are 2 kinds of molar uprighting. There are molar uprighting when we're controlling a little bit of root, but when we're pushing the molar backwards, like we're doing uprighting of molars, pushing them backwards, this is easy to do with braces, and likewise, it's easy to do with aligners. So when we push them back, we might get a very, very good result when we're treating with aligners only. So that's actually not very good root control, but we can do it with aligners by themselves. And we can get a good uprighting. We can get space for implants. But that's not actually what we're going to talk about. We're going to talk about very, very, very large root control. And the main reason why aligners cannot control roots very well is because there's a lack of ability to produce high enough couples. So this is a good example where aligners are not very good to do tooth movement. But I could manage to get a good result. So how did I do this? I came up to this patient, I said, well, you need to give me a few months with fixed appliances in the lower arch. She said, okay, it's only in the lower arch. I said, yeah, well, I'm good with it. So I started treating with aligners in the uppers and braces in the lowers. And all those braces, the tubes in the molar, the braces in the bicuspids, they're all with a lot of overcorrection. So there's overcorrection in the molar, there's overcorrection of rotation in bicuspid. There are chain elastics there trying to manage root. Because when we're doing hybrid, we need to get what aligners are not good for and trying to fix it as fast as possible with braces. So this is in the first month with, let me go back one slide. Okay, it's not going back. Okay, so this first month, it's a copper night tie, 16 by 22, the lower arch. Then on the other month, you can see the buttons there with the aligners. We place the bend on the copper night tie. There's elastics there. She's using triangle elastics, so we can reverse that curve of speed. And we got up to here. So this is 4 months of treatment. And that's when the patient came up to me and said, well, you told me 3 to 4 months and that's enough, so now you need to remove it. So therefore, there's my first tip to you. Never say 3 or 4 months. You just say, well, I need 1 year, 6, or whatever. Because I believe from the amount of correction that I got here, that if I had 3 or 4 months more, I could get to a very, very good point. Okay, I removed. Then we moved into the first refinement, and I tried to do a bootstrap there, and intentionally the buttons are to the mesial to direct a vertical force away from the center of resistance, and try to get a little bit of uprighting with the elastic force. However, because I cannot get too much force out of that elastic because it doesn't stretch much, I couldn't get a very, very, very good result. It improved a little bit, but not much. And then I finished my first refinement, and I took a panoramic X-ray, and I noticed that part of the problem was not only the molar, but also the bicuspid. So we moved on to our second refinement and replaced the small tubes. So this is a sectional hybrid approach, and she agreed with it as long as I didn't bond the second molar and as long as I didn't go with the braces up in front. Again, it's my fault. I should have talked to the patient a lot more before I started treatment. And that's how we managed to get here. Still not perfect, but this was 3 years of treatment. Patient was tired. And that's why also we should look into time when we're treating with aligners. This is her last week with 5 years post-treatment. Still, I could have done a better job with the molar, but it's stable. And I didn't get an X-ray because she's pregnant. So, I'm sorry, maybe next year I can show an X-ray. So, there's 2 kinds of uprighting, okay? If you're moving the molar back, it's good to do with aligners. If you're moving the root forward, it's good to do with hybrid. Here's another example of a patient with a severe impaction of second molars. She wants aligners, and there's not enough crown to push the molar back, even if I remove the third molar. So what did we do? Hybrid again. However, this patient, she didn't allow me to put braces up in the front, so we did sectional. And we put nickel titanium wire and open coil springs. And you might ask me, oh, you might get some side effects here. The mechanics is not very good. Yeah, I agree. But we are trying to do as fast as possible the movements that our aligners are not going to be able to do by themselves. So here's 1 month, and here's 2 more months afterwards. And you can notice that I'm trying to do some bends to achieve some correction on the bicuspids as well, because we know bicuspids do not respond well to aligner therapy, which we're going to do afterwards. So I'm trying to do as fast as possible everything that I can, which I know that aligners are not good for. And here, I believe it's 7 to 8 months afterwards, and she's ready to start aligner therapy, which we could not do. We could not get to this point with aligners only. Another case over here is a patient, a class 2, with a good positioning of upper incisors. And he is a severe class 2. So it's a full step class 2. And he doesn't want surgery. He's got a nice smile. And we cannot retract the upper arch. So what did I decide to do is to open up space for a third premolar. So this is a technique that we've been doing for some time. Dr. Larry White, a good friend of mine, has been encouraging me for, I think, the last 10 years to write something about this, so hopefully we'll do. So we're going to open up a space for a third premolar in both right and left side. But we need to open up space controlling the roots, something that aligners will not do very well. They might open up the space, but they will not diverge the roots. So this time, I was smarter and I told the patient, I'm only going to treat you if you allow me to put braces full time in the lower arch. They said, okay, if it's in the lower arch, it's fine, as long as they're ceramic. Okay. So we opened up the space. We have a class 1 canine relationship, a full step class 2 in the posterior teeth, and the patient can move on and put his third premolars in place. I'll call attention to the parallelism of the roots, which will allow the implants to be correctly placed. And especially without moving his upper incisor to an anesthetically position, without moving his lip posteriorly. Now, you might ask me if the patient will accept hybrid. We have an article out of Brazil that they asked patients with pictures if they would prefer clear aligners only, and of course we know that all the patients will prefer clear aligners aesthetically, but there's an interesting conclusion, is that they might accept hybrid if you can explain the patient and if the patient understands that it's needed, if it will shorten treatment time, for example. They might accept it. So another situation where it would be very good to apply hybrids with vertical movement, especially with extrusion. Pure extrusion and antagonic movements with extrusion with proclinations, they might require hybrid orthodontics. I spoke about this last year. I'm not going to speak about it again this year. So I invite you to take a picture of the QR code and maybe watch about vertical, about extrusion. It was the subject that I spoke last year about. But anyways, if you need extrusion of the upper teeth, like this girl, we want to expose a little bit more gingiva. If we want to procline a little bit, because her upper incisor is retroclined, this is not a good movement to be done with aligners. This is a good movement to be done with fixed appliances. So this girl, I asked her if she was okay with bonding brackets, because if she would go with aligners, that would require around 60 aligners to extrude her upper teeth. That's in the minimum, with very low accuracy. So we placed clear brackets, anterior box elastics. This is initial, this is 4 months. And we removed the brackets and we moved on into aligners. So this total treatment time was around 8 months. And we could expose more incisors. We could expose more gingiva, and we proclined incisors. So this is a very good situation. You can look at that at last year's lecture about it. Rotations are also a situation where we can profit a lot from hybrid, especially with standalone rotations. That is, rotations around the central axis of a tooth. If we look into the literature, premolar derotation has a very low accuracy. Large rotations have a very low accuracy. Fast correcting rotations have a very low accuracy. Aligners are not effective to correct rotations of rounded teeth. Rotation correction has a very low accuracy. So we know that there's a big problem with rotations in aligners, especially with canines, especially with bicuspids. So this is a very good friend of mine that I treated with aligners. He had a severely rotated upper canine. We did his first sequence of treatment. Apparently, we got it to a very good position with the canine. Here is his scan for refinement. And we see that we corrected the crossbite. We opened up space for cosmetic, but the canine is still severely rotating. I tried to do one refinement with him, doing like a round tripping with rotations on the canine, which supposedly enhances the ability of a aligner to get rotations done. It didn't move. It just went buccally and came back lingually. It probably corrected 1 or 2 degrees, and it took me 5 months to do it. And then we moved into the second refinement. And I'm not going to try the very same thing again. So what did I do? I got a very tiny, small tube, ceramic, and we put in a cantilever, and the aligner fits over it. And you can ask me, well, this is not very aesthetically. Well, it depends how high you go, and it depends on the patient. So you can't see even when he smiles. So what we're going to do here is that we're going to activate this cantilever. When it's activated, it produces the couple that I need. It produces the rotation that I need. However, it also produces a lingual force, which is something that I don't need. And it produces a buccal force at the molar, which is something that I do not need either, because the molars are in a very good position. So the load system that the cantilever is going to produce is this one. And because there are certain movements that I do not want, what am I going to do? I'm just going to do the opposite movements on the aligners that are going to be fitted over the cantilever. So there's a buccal force on the canines, and there's a lingual force at the molar with the rotation against the one that's going to be produced at the molar, and another rotation that will allow the canine to be moved into the position that I want. So this is what I want, the movements that I want for my refinement. It's 2 aligners. Because the cantilever was placed in, it was the very first time I've done this, I was very scared that it might rotate too much. So I told him to come back in 3 weeks. And in 3 weeks, I got 11 degrees of rotation, which would probably take me 5 months, or at least 5 aligners, 3 months to be done with aligners only, if the aligners were able to do it. My first refinement showed me that it wasn't. So I'm going to put those 2 together now. Large rotation and an extrusion to show you another case of a hybrid approach. And now this one, I cannot do it wrong because it's my wife's. I want to be able to come back home and she needs to be happy. So she does not like the aesthetics of her canines because of the space that appears when she smiles and because of the very pointy canines. However, when we look into the setup, she's got 32 degrees of rotation to be corrected, and I need to extrude the canine 1.5 millimeters to grind off the cusp. That will account for around 40-something, 50 aligners. That's 2 years to resolve the question of the canine. That's too much. That's 2 years in the minimum. I'm not even sure if it's going to solve it. So we moved into brackets first. We did an IDB, a 3D IDB to bond. And this is interesting because if I place, and clinically I would place the canine bracket at the center of the crown, and the software tells me that if I did this, I would not completely correct the rotation of the canine. I would have to move the bracket a little further distal. So, but if I only, the thing that I need to tell you is if I bonded regularly, it would correct me and I would need another month to reposition the canine, so it would lose me at least 1 month because I would not be able to guess this unless I was using the software. So we moved it back a little bit because the rotation is so severe and I'm expecting a little bit of relapse. I'm gonna move it back a little bit more to overcorrect. And I'm moving it higher up so I can get the extrusion that I need. So you can see the estimate is something that I would call your attention to, is that in the lower arch, it's passive on the vertical because I want to go with the rectangular arch wire as soon as possible on the lower so she can use vertical elastics to bring the canine occlusally. So you can see initial 1 month and 2 months of treatment only with brackets. After 4 months of treatment, or 3 months of treatment, I'm sorry, that's where we brought her. Canines came back, rotation solved, a little bit of relapse between the scan and between the time where I took the pictures and installed the retainer, the aligners, I'm sorry. Already grinded down the canine. And here's the plan for her aligner treatment. So it's just the alignment of the lower arch, a little bit of alignment in the upper incisors, second molars, 9 pairs of aligners. So I'm expecting 4 months and a half here, plus 3 months of brackets, that's around 1 year. And I'm comparing to the minimum of 2 years with aligners only. So it's a lot of difference of time. So there's the second situation that I told you that we need to talk about, is about efficiency, because we were talking about efficacy, something that aligners do not do well on the examples that I gave you. Now, there are 2 certain situations where aligners, they're pretty good to deal. Now, large rotations, if you have like a favorable situation, they might solve it, and AP corrections as well, but they're not fast. It might take forever. So large rotations may require hybrid mechanics, because as I told you already, rotations are very hard to deal. But if you take a look at this case, which I've done a long time ago, we have the setup of a complete rotation of a lower canine. I don't know if you can see, but it's 84 aligners to get it done. And this is the scan of my first refinement. After 84 aligners, I got to here. Only half of the correction. So 84 aligners brought me here. And then 30 more to get to the end, if they get to the end. Well, they got to the end. So with this patient, he didn't want anything bonded, so I had to actually go all the way with full aligners. But it took me almost 120 aligners to get me here. And because I change aligners every 2 weeks, this is like 3 years of treatment because of one canine. So that's a lot of time. However, that taught me a lesson. Another patient came in, and look, it's very similar rotation. But I'm not going to take 3 years to resolve this. So I asked her, I said, well, can you give me a few months with braces? Say, yeah. Because in the minimum, if it was possible to correct 2 degrees per aligner, it would take me 30 aligners. So what did I do? Nickel titanium wire, chain elastics, trying to rotate as fast as possible the canine. Oh, that might give you some side effects in the molar. Yes, that might give me some side effects in the molars. I'm not worried about this right now. I'm actually using the chain elastic to get some rotation of the other canine as well. And in 3 months, I'm here. And I also did some circumferential fibrotomy, which is something that helps us a lot with severe rotations. I didn't mention it, but in my wife's case, I also did the CFS as well. And now 3 months, I'm ready to remove the brackets, place aligners. I still have 2 degrees of rotation, yeah, but that's fine. I had something to do in the upper arch. 4 months more, and I'm done. So 7 months of treatment compared to 114 aligners. So it's a very good situation where hybrid orthodontics might help us to get a more efficient treatment. Another situation is with large AP corrections. Aligners are effective most of the time to produce corrections, class 2 and class 3 corrections. However, it might take you forever. But it depends. If you do not get distalization, for example, this patient has a Bolton discrepancy. The premolars are large for the lower ones, and there's IPRs that have been done. So we managed to treat a class 2 pretty fast and pretty well with aligners. But that's not what we're talking about, because you can see that the molar is in class 1 since the beginning. Molars in class 1, canines are in class 2, so that's Bolton discrepancy, right? That's not the case. We're talking about cases of higher complexity. Because of low complexity, you can treat with aligners, no problem. You don't need hybrid to treat class 2s and class 3 of low complexity. You can do it only with aligners, especially if IPR is allowed. If we look into the class 2 literature, it shows that we are effective in treating up to 2 millimeters of class 2, which is very, very small. And it's a half step, class 2. And if you look further in the literature, there are even papers that say there's no correction at all, very small correction, because we depend exclusively with the cooperation of the patients. So severe class 2s, severe class 3s are a problem with aligners. So take a look at this case, a half step class 2. Her upper incisor is in a very, very good position. I'm going to do some restoration. So our planning is basically to distalize canine bicuspids and molars and get the buildup on the laterals. If I go to my software, and if I try to do a sequential distalization in that case, using the minimum aligners that would be possible to be used, it goes up to 43 aligners. That's 2 years of treatment. So what can we do? So it's 2 years only to get the canine into position. I might use a distalizer, because I'm going to need cooperation with elastics anyway, because you do need elastics when you're doing sequential distalization. If you have a very good patient like I had, 3 months of treatment, that becomes a very simple case now. So it's 3 months versus 2 years. It's a very, very long time. Even if you're using, I do a lot of aligners with the company in Brazil. Even if you use another company in the US, you might get a package of aligners which is a lot cheaper. So that's not only time of treatment, that decreases your overhead, decreases your cost. There it is, her case finished. And we can do the same for class 3s. This is a very tough case that I'm still not finished with the aligners, the second phase, but it's a severe class 3. If we do the same, 43 pairs of aligners, because we're moving the posterior upper forward, and we're moving the lower to the distal. 2 years. So what did we do? We put the upper distalizer, the lower. I put some composite on the hinge because I do not want rotation of the molar. And I did a sequential, bonded passively, ceramic brackets on the upper. So it's going retraction tooth by tooth, class 3 elastics. It's a 1925 nickel titanium, which was there because I bonded the tube and the brackets passive. And 3 months of treatment later, and again, I'm showing you very, very good patients. We get the premolar into class 1. And now, the case is very easy to be treated with aligners. We're here at almost the end of the refinement, the first sequence of aligners. And I noticed, because he had that class 3, we open up space distal to the canine. Now you can notice that when we've closed the space, because aligners do not have the control of root that we need, that his crown is distally tipped. So I'm not going to bond brackets in the lower arch from 7 to 7. I'm going to go and try to work with a cantilever again. So we have a lower cantilever that's fitted under the aligner that is activated this way. We get an extrusion on the canine, we have the tipping moment that we need, and we have an intrusion on the molar, which happily we are gonna try to counteract with the posterior elastics. And the extrusion, hopefully, is gonna be held down in position by the aligner. So we got to here, and now we're about to go into refinement with him. So it's a sequence of 21 aligners, plus the 3 months, so it's less than a year for a very hard treatment that would take us 2 years only to get the relationship of the canine if we did aligners only. Here to here in 1 year. So, what are conclusions? Hybrid orthodontics, it will allow the effective and efficient results by combining aligners with fixed orthodontics, especially in cases where aligners alone are ineffective or inefficient. So to take home the situations that I brought you, and hopefully I was good enough to show you and convince you, is that angulations, if they come from uncontrolled tipping, you can use aligners by itself, which is very good, by themselves. If root angulation or translation is needed, you will profit a lot from hybrid orthodontics. In the case of rotations, if you have small rotations, go ahead. Use aligners by themselves. If you have large or standalone rotations, go hybrid. If you have stubborn rotations, do not keep trying, because no matter how many refinements you're gonna make, you're not gonna get into your final objective. Go hybrid. In regards to AP corrections, if you have small corrections, especially if you have posterior bolt-on discrepancy, go with aligners by themselves. They will be effective. They will be effective and will be efficient to treat that case. However, if you have very large corrections, go hybrid. And if time is of essence in your office or in your relationship with your patient, you should always think about going hybrid. Thank you. Hope you enjoyed this lecture. Sorry that I
No problem. No problem. Thank you very much, Dr. Martins. I guess the time is over, unless if you have a serious question. Okay. So thank you very much for staying that late. I really appreciate your patience with us. Excellent presentations and excellent audience. So please give yourself a good round of applause. Thank you.